In late 2019, COVID-19 first made its appearance in the city of Wuhan, China. Seemingly overnight, it spread around the globe, leading to many hospitalizations and fatalities. The lockdown may have ended and the worst of the pandemic may be behind us, but this coronavirus strain left a lasting mark on the world. How many people have died from COVID? How prevalent were the hospitalizations? Let's break down the numbers. The estimated death toll varies based on the source, and some sources have more up to date data than others. But here's where we stand at the moment. Statista has some of the most current information, stating that as of May of 2023, nearly 6.9 million people had died from COVID 19. Deaths were more prevalent in the United States, 1.2 million, followed by Brazil, a little over 700,000, and India, over 531,000. The World Health Organization, or WHO, reported that in January 2020, when COVID 19 was officially declared a public health emergency of international concern, the official death toll was 171. By December 2020, that number had climbed to more than 1.8 million. However, additional research says that the number of people who had died from COVID was likely closer to at least 3 million. The Centers for Disease Control and Prevention, or CDC, reports that since January 1st, 2020, the total death count for the United States alone is nearly 1.2 million, updated weekly, more specifically, slightly higher than Statista's most recent data from May of 2023. Interestingly, men seem to die from COVID 19 at a higher rate than women, although researchers aren't totally sure why. It could have something to do with the timing of surges, state health policies, gender associated health behaviors, and occupation. However, it's worth noting that differences between the sexes are very sensitive to the context. No one factor can explain it. But here's an important note about this information. While organizations like the WHO and the CDC are highly reputable sources, it's important to note that these numbers are still estimates. Many sources agree that plenty of cases of what was probably COVID 19 went undiagnosed and/or unreported. Additionally, some sources differentiate between deaths caused directly by COVID 19 and deaths due to another cause that may have been exacerbated by COVID 19. More on this in a moment. So, how many people have been hospitalized for COVID 19? The CDC has an interactive dashboard displaying hospitalizations over time. Interestingly, with the exception of the year COVID was first announced, hospitalization rates seem to be highest during the coldest months, November, December, and January, before dropping off again, coinciding with flu season. At the time of recording, hospitalization rates are the lowest for this time of year than they were the 3 seasons prior, 8 individuals for every 100,000. While getting a total count is difficult, NBC News, using 7-day averages, says that in January of 2024, COVID-19 hospitalizations peaked at 30,580. Hospital rates have been the highest in North Carolina, 1,658, and Maryland, 1,001. South Dakota has seen the biggest increase in the number of hospitalizations, up 50% from 4 to 6, and Minnesota has been the biggest decrease, down 73% from 5 to 1. Now, do people really die from COVID 19? As we mentioned earlier, while COVID 19 in and of itself can be fatal, it's not always that straightforward. The CDC interviewed Robert Anderson, Chief of Mortality Statistics at NCHS. As Anderson explained, in almost all cases, COVID 19 leads to some other complications, even if there are pre existing chronic diseases. So for those that die from COVID 19, COVID almost always initiates a sequence of conditions, and those can include respiratory, cardiovascular, and neurological complications. What that means is, more often than not, someone acquires COVID 19, which causes one or more other health issues, and those ultimately end up being fatal. So, how deadly is COVID 19 today? Perhaps unsurprisingly, COVID 19 isn't as threatening as it was at the onset. According to Medscape, it was the third leading cause of death for Americans in 2020 and 2021. But by 2023, it was the fourth leading cause. There are probably a few reasons for this. For starters, somewhere in the neighborhood of 70.6% of the world's population has gotten at least one dose of a COVID-19 vaccine. 13.57 billion doses have been given around the world, and 8,112 are administered every day. These vaccines have helped slow the spread of the coronavirus, protecting our families and communities. Second, while we haven't reached herd immunity, it does stand to reason that because so many people have been infected, it's provided some degree of additional immunity, albeit temporary. Third, it's possible that overall we're more mindful of practicing good hygiene and social distancing. Out in the world, you can still find people wearing masks. Many businesses started encouraging better sanitation practices, for example, by offering hand sanitizer to customers, and continue to do so today. And immunocompromised and elderly people are probably more cautious than they previously were. For instance, some elderly living communities still practice social distancing and limit how many guests can come and go. And finally, COVID-19 testing is more accessible and affordable. While it was difficult to find testing during the height of the pandemic, something that required you to physically drive to a testing facility, many tests are now available at local stores and pharmacies for around $20 a box. Now, will COVID ever go away? In general, coronavirus has been plaguing us for a long time, accounting for a significant percentage of the common cold. It just so happened that a particular strain came about to cause a pandemic. In all likelihood, COVID-19 is here to stay. However, over the years, it has been linked to the flu, although research continues. It's fairly prevalent, and outcomes may be improved if caught early and addressed accordingly. However, it can be serious and escalate into more severe and long-lasting health issues.